So do you think we socially experience pain and pleasure? So when someone in physical pain comes to you and they're experiencing the psychosocial aspect of pain, it's not just physical, and you enter into that with them, does that in and of itself sometimes alleviate some of the pain? It doesn't hurt as bad when I'm sitting there talking with you.
Well, I think it works on there's two interesting things there. So one is just the validation, right? So most patients feel like they have to defend their reported pain, right? They don't want to be seen as drug seeking. They don't want to be seen as malingering. Let's say they have an X-ray or they have an MRI, which looks normal, normal study, no degeneration noted, no soft tissue damage noted. These patients are coming and they want to know that you believe that they feel pain, right? So just simply saying, listen, I know your pain is real. I don't know why you're experiencing pain, but that's what you're here for, and that's what we're going to figure out. Like that in and of itself will help decrease some of that anxiety, some of that guard that they come into a clinic with, and can actually decrease some of their pain, their perceived pain. And then there's that whole social thing, right? So humans have mirror neurons, and they've done studies of people that have been diagnosed with like low back pain, for example. They will watch somebody lifting a box, like from the floor up to a shelf and then back and forth. Two instances. One person is lifting the box, no pain, and the patient's watching this other person who's not them lifting this box will feel a slight increase in their perceived pain level. But then they'll make that, person, the actor, do this number or kind of, my back a little bit when they're going to lift this box, and the patient's perceived pain level will go up. So there is something about environmental and social cues, both on the kind of like the neuroscience level, like that mirror neuron.
Yeah.
Socially, we're trying to show empathy, but also like if I have pain myself, like, oh man, my own brain is telling me like there's danger around if I get called in to move these boxes.
It enhances your own perceived experience.
Exactly.
And could that go on the opposite side with pleasure or euphoria?
Yeah.
Like being at a concert and being like, this is kind of cool, but like all of a sudden the person next to me is like really enjoying it. And I'm like, wait a minute, I'm really into it now.
Yeah, that's a very real social phenomenon. It's the same reason that if somebody smiles at you, most of the time you'll smile back.